Every parent in the country knows the misery of ear infections. Even if they don't remember them themselves from their own childhood, believe me, it's highly likely their children will go through them at some point. Ear infections are really, really common, and the most common kind, certainly in children, is a middle ear infection, otherwise known as otitis media. You know, we love long medical terms. Basically, right behind the eardrum that you could get to if you went in far enough, but don't, we see a clear drum, and behind that a space. That combination of space and eardrum is called the middle ear, and inflammation of the ear, that's itis, think appendicitis or tonsillitis. Itis, inflammation of the ear, is called otitis in the middle ear. Now, the most common symptoms in kids are pain and fever, perhaps not surprisingly. These symptoms tend very much to happen in winter because, of course, most cases of ear infection are caused by infection, particularly viruses which are similar to the common cold viruses, and they, as we all know, happen most during the winter months. Your child may be really quite grotty, quite unwell, a little bit lethargic. If they're over about 2, they should be able to tell you where the pain is. If they're under 2, they may just be very, very distressed, in a lot of pain, and have a fever. The good news is that the vast majority of middle ear infections settle on their own within a few days. In fact, lots of studies have been done looking at whether giving antibiotics speeds up your recovery from a middle ear infection. Almost always it makes no difference at all, and that's why these days GPs very rarely give antibiotics for middle ear infections. They may make an exception for under 2-year-olds because they're more likely to have a bacterial infection, and of course bacterial infections will respond to antibiotics where viral infections absolutely won't. They may well give antibiotics if you've got an infection in both ears, and we do very much need you to be aware of a really rare but very dangerous complication called mastoiditis. If your child has mastoiditis, and again I'd stress it's really rare, then they will be extremely unwell, they'll often be delirious, and they will be incredibly tender right behind the ear. But that doesn't apply to the vast majority of kids. So if you think your child's got an ear infection, what do? Well, if they're under 2, if their temperature is really high, if they're extremely unwell, yes, see your GP. However, if it's just one side, then the likelihood is it will settle within a few days. Some GPs will give what's called a delayed prescription for antibiotics. They give you the prescription when you go in and say don't give it unless the symptoms are still there a few days later. Paracetamol, ibuprofen, which works even faster than paracetamol, are both really, really good. They will help with the symptoms and they're not going to mask anything that's going on, so you won't miss anything because they're taking the symptoms. Sometimes the eardrum can burst and lots of horrid, yucky yellow pus will come out, which can smell quite nasty. Don't worry about that, because actually most of the pain your child feels is because of a build-up of pus behind the eardrum. Once that's come out, the pressure will be relieved and they may feel much better. Whatever you do, do not be tempted to put a cotton bud inside their ear to clean it. I always tell my patients, never put anything in your ear that is smaller than your elbow. In other words, nothing at all. At worst, you can perforate the eardrum yourself. At best, you can irritate the delicate lining of the eardrum. So cotton buds are for tummy buttons and makeup only. How can you stop your child getting ear infections? You can't, but there is lots that you can do to reduce their risk. Firstly, we know that children who are breastfed are less likely to get episodes of otitis media. Secondly, smoking. Even if you don't smoke in the house, if there's a smoker living in the house, that hugely increases your child's risk of getting otitis media. It's just another reason to stop. Thirdly, there's some evidence that having dummies may increase the risk of otitis media. Having said that, there's also now some evidence that it may cut your risk of cot death. So it's a balance. Certainly never put sugar on dummies. Don't force a dummy on a baby. But other than that, it's up to you.